All right. Ellen, can you change the next one, please? Thank you. Good afternoon, everyone. My name is Veronica Cordova, and I am the Grants and Program Manager for the Greater Washington Hispanic Chamber of Commerce. The Chamber mission is to support the economic development of the Greater Washington region by facilitating the success of the businesses and the communities they serve through networking, advocacy, and education. We are glad today to partner with DC Health Link, El Tiempo Latino, Latin American Youth Center, and the DC Chapter American Academy of Pediatrics to host today's town hall, A New Year, New Challenges for Hispanic Health. Before we start, I would like to mention that we are providing Spanish translation at this webinar. Para seleccionar español, si está utilizando una computadora, por favor, seleccione el botón que dice Interpretación en los controles que están en la parte de abajo de su pantalla y elija español. Si está en una tablet o celular, haga clic en los tres puntitos en la esquina inferior derecha de su ventana Zoom. Luego, en Interpretación de idiomas y seleccione español. Si no selecciona idioma, no podrá escuchar al intérprete cuando hable en su lengua. Great, so I would like to introduce to our moderator for today's webinar, Rafael Ulloa, Executive VP of Contact of El Tiempo Latino. Rafael is a founding team member of El Planeta Media, publisher of El Tiempo Latino in Washington, D.C., and El Planeta in Massachusetts. He oversees the contact strategy for El Tiempo Latino and coordinates the local editorial efforts of the team. He also produces and hosts Facebook Live programming. Rafael was involved in the media, marketing, and advertising work in his native country of Ecuador. Rafael, I'm so glad that you're also Ecuadorian because I am Ecuadorian. Rafael has been a copywriter for advertising agencies before switching to journalism. He also hosted and produced radio shows and wrote for several magazines. He graduated with a master in integrated marketing communications from Emerson College, Boston. He is a resident of Shaw in Washington, D.C. After moving to the district in May 2019, in his free time, he loves to visit the Smithsonian Museum, attend shows at the 9:30, Black Cat, and the Anthem, and try new restaurants. I'm very glad to present to you Rafael Ulloa.
Thank you so much, Veronica. Really glad to be here. El Tiempo Latino is really proud to support this webinar and, of course, to promote the health and well-being of our community. El Tiempo Latino is the largest newspaper in this region, and we also have a national reach of 8 million people per month. And so we are really happy to support this mission of the DC Health Link, DC Health Benefit, and, of course, all our partners joining us today. This will be a really good webinar, so get ready. There will be a lot of important topics that we will discuss today. We have a new year with new opportunities, but of course, as the title of this webinar says, we have new challenges for Hispanic health. So in this webinar, we will touch topics like health issues that are most important for the Hispanic community, how to overcome barriers and access to care, the lifestyle and wellness, how to optimize the Hispanic health, and of course, immigrant health, access, and resources. We have a really, really good group of guests, a great group of guests. So the agenda for today will start with an overview of the Hispanic health by Dr. Maria Marquez. We'll have a Hispanic community mental health care section with Dr. Maria Lauer. We'll have immigration and mental health care presentation with Dr. Natalie Kion. And of course, we'll talk about the importance of health insurance with DC Health Link. This is the week of action for DC Health Insurance, and that will be with Antonio Guernica. After our four great guests present their slides, we'll have a Q&A part where you can like send your questions. You can start sending your questions actually at any point, but we will reserve the end of this webinar for answering those questions. And we'll have a brief evaluation and the final thank you message. So that should be all. Like, get ready. If you have lunch, start eating your lunch. This will be a really interesting webinar. And of course, we have interpretation in Spanish. So I would like to start right now introducing our first guest. Our first guest for this afternoon is Dr. Maria Marquez, la doctora Maria Marquez. She's a pediatric provider with more than 20 years of experience in the District of Columbia. She is the medical director at Mary Center Fort Totten and the vice president of clinical education at Mary Center as well. Dr. Marquez is also a Georgetown University School of Medicine professor of the Department of Pediatrics. She has been a pediatric provider at Mary Center for 6 years. Dr. Marquez, really great to have you here. I know you have a very interesting presentation to share with us.
Hi, good afternoon, everybody. It's an honor for me to be here with you, and thank you for this tremendous opportunity. Next slide, please. So we want to talk about challenges of Hispanic health today, and I'm a learner that likes to learn why happened, what is the history. So I'm going to chat very quickly about kind of the origin of Hispanics communities in the District of Columbia. So we have to go back to the 70s, where there were a lot of wars and in the world. And the main ones I want to highlight were the Guatemalans and El Salvador were going through civil wars at similar ages or times, some longer than others. And at that time, the community of Salvadorians were coming to the District of Columbia, and LA, being the District of Columbia, the second city with the highest number of Salvadorians in the country. Salvadorians left their country at that time in the 80s. They lost 20 to 30% of their population during the war. And we, the district, were hosting and welcoming them during that time. They settled in the area of Adams Morgan, Columbia Heights, and Mount Pleasant. And this also was associated with changes of asylum and immigration laws that former President Carter created a Refugee Act in the 80s. And what it did, it increased the number of asylum available for immigrants to enter the country. And they went from around 17,000 to 50,000 per year, and also were really clear defining what refugee was at the time, and is any person who had fear to go back to another country when they feel that they're going to be persecuted. So that's kind of why I want to make sure we go back to the 80s. But today, Salvadorians are the largest Hispanic group in the District of Columbia. They represent 11% of immigrants in the area, and also they represent 32% of the Hispanics in the area. Next slide, please. And in 1988, Mary Center was created, and with a mission to embrace all communities and provide equitable, high-quality healthcare, education, and social services to build better future for all. The creation, I wasn't here, but the creation of this institution was to provide frictionless services to every member of the community, making it easy as possible from theory to action very quickly, and patient-centered care are always part of our main pillars. So next slide, please. Key facts are that Mary Center was designated a Federal Quality Health Center as in December 2005. Today, in 2021, it was estimated that we saw 65 participants, and around 44,000 were Hispanics, And I want to remind people that in 2020, the Hispanics were 11.3% around there, and 67,000 total. Visit, we have like more than 300,000 visits in 2020. We are today an organization of around 870 members, and we have 5 clinics, as you can see there. 3 are in the District of Columbia and 2 are in Maryland. We also have 27 mental health school-based partnership in DC, and 2 medical schools-based, 1 in Washington and 1 in Maryland. And we also are having participants that speaks other language than English, around 70%. I just want to highlight from the next little round tables that we have there is that the number of percent of patients that we see that are Hispanics today or identify as Hispanics are around 68 to 70%. And it started being 100% in the 80s because Mary-centered conception was to assist the community. And at that time, the need was pregnant women that needed to get prenatal care. And that's the conception of Mary-centered at that time. Next slide, please. So through the years, as I mentioned, it's a frictionless service. So we always try to make it as easy as possible for the participants. Also, we are in a mindset of growth and making as possible all theories or all needs tangible and actionable as soon as possible. So in this way, we progressively evolved to what we call a social change model system, where we have 3 pillars. One is education, and education, we have different, as you can see there, different ways to make sure that we prepare the person for a better future, regardless of what you need. And we offer a lot of ways through the years and creating more and more programs to help and pursue these goals. The other one is social support. And we do have a lot of programming and that have been created through the years that will support these necessities for all our participants. And we also have a very comprehensive healthcare model where we have integrated medical, behavioral health, and dental at all sites, at most of the all sites. Some of them don't have still the dental, but most of them have all of the others. We try to systematize the process to all of the clinics. Next slide, please. All right, so I'm here to talk a little bit about the challenges today, Hispanic health. And you have a table that may be a little busy, so I'm going to talk a little bit about what it meant. The leading causes of death since 2020 has been COVID infection-related death, heart disease, and cancer. That's something that we have is new because we didn't have COVID before 2020. But heart disease, cancer, and metabolic disorders used to be the main causes before the virus came to us. Most common conditions are obesity, where men, Hispanic men, have been diagnosed with obesity 44%, and women 46%. Hypertension also is another comorbidity that it has been very prevalent. Diabetes as well, 12.5%. And nationally, I want to remind that around 25% of the cases of COVID and 70% of death in the country have been related to COVID. In the District of Columbia, around 13% of death have been related to COVID in our community. And I say our community because I am a community member, I am Latina woman, and I'm also a provider in the community. One of the things that also has to be highlighted, and we have an expert talking about this to all of us today, is the mental health. We had seen an increment of depression around 40%, and in a higher rate than other group of people. Per the census, the population, Hispanic population in 2020 has been 62.1 million. We are today 19% of all Americans, making us the second largest racial or ethnic group behind white Americans. Per the Pew Foundation, Mexicans are the largest group of Hispanics, around 65%, and in 2019. And the next one will be the Puerto Ricans. The fastest growing group are Venezuelans, around a rate of 126%. The second one is Guatemalans and Honduras. Latinos living in the US are mainly born in the US. The peak of immigrants, Hispanics, was in 2020, and it was 40%. And then after that is plateauing or decreasing slightly. So we don't know what the composition will be in the future. And today, the number one immigrant Hispanics are Venezuelans per last year data. Next slide, please. So I want to make sure that we remember that Hispanic has been have very different degrees of illnesses, of health risks than other ethnic group like white or Black Americans. 35%, we have 35% less heart disease, a lower rate overall, but about 50% higher death rate from diabetes. 24% more poorly controlled high blood pressure. So those are the main two that are need work. But 23% still also are more obese, and this is not the final data for 2022. I think it's higher than that. And we also don't do well screening. Our markers for screening for cancer are not there yet, but still we have a lower incidence of death for cancer, except the cancer related to infections, that is the cervical cancer, that we are higher than other ethnic groups in the country. Hispanics have usually lower cholesterol, lower cancer, as well as coronary heart disease compared with other ethnic groups. And we already mentioned that diabetes is one of the highest morbidities or diseases that we are very high at this moment. I want to highlight that Mary Center is conducting at this moment a study in partnership with the NIH, and we do have preliminary reports that participants that went through the comprehensive medical system and the programs, social support and education, do much better with control of diabetes, hypertension, cholesterol. So it's one of the models that if the final reports keep showing this, may be a solution, because it has been described that the more we educate, the more that we intervene in different aspects that is not only medical, the better for the person will be. Next slide, please. Excellent. So I want to make sure that we talk a little bit about teens. I'm a pediatrician, and I want to remind everybody that 22.2% in DC population is obese with a BMI greater than 30. That's for adults, and greater than 95 percentile BMI for children, of which 35.8% are Hispanics. We want to highlight that teenagers Hispanics are 18.2% obese, compared with the US 15%, so a little bit raised. Teen physical activities or exercising is 19.9 Hispanics versus 44.1 in the US. And this is in DC, Hispanics in DC. And then teenagers eat around 13.6% vegetables and around 14% fruits. Also, teenagers drink sodas a lot, even more than the US average population. And in the District of Columbia, 80% of Hispanics are drinking sodas during the adolescent time, between 13 to 20 years old. Next slide, please. So mental health, we have an expert talking about it, but it's affecting and it's going up after the pandemic started. And I want to make sure that I highlight depression Medicare population. Hispanics 9% have depression, and in the US it's 16%, but it's rising. And teen attempted suicide, 16.4% Hispanics in the district, compared with 8.9% in the US. And drug opioid overdose is also incrementing rapidly. And it's 10.2% Hispanics in the district, compared with 23.5% in the US. Next slide, please. And one of the main things that I want to highlight is, and celebrate as well, is that we all are in a very tough time health-wise, and we all have to try to understand why and how we're going to do, I call it the new normal for health. And as you know, we were paralyzed in some way by this pandemic, and now we all have to do and assess and intervene for the new normal. So one of the things is children's insurance in the District of Columbia for Hispanics are 96%, versus in the US is 94%. And adult healthcare insured is also for Hispanics 95.7%, and then in the US is 87.8%. We still can do better, and but we have to really celebrate this high insurance and health support for our communities. Next slide, please. Great. This is next slide. Great. So other challenges that I want to talk, because this is still happening, is COVID, and it's still here with us, and immigration. As we know, some other factors are gentrification. Some people with this process of gentrification may have to move farther from the big cities, and especially in the district or from the district. Immigration policies are changing every day, and we have to be attentive to that. As I mentioned, around 35 to 40% of our Hispanic communities are immigrants, not born in the US. Violence through the area also may have changed our communities, and some models of Medicaid and may also change the support for social determinants of health. 12% of Hispanics adults were not confident to pay housing in the District of Columbia in 2021. So it's a big elephant, and we all have to be attentive to this, especially during these times. Next slide, please. So COVID, as we mentioned, COVID cases in Hispanics in the district was 14%. Total Hispanics in the DC population is 11% today. And COVID deaths were 13% of the District of Columbia Hispanic population, and high, and in the US 17% death for with COVID. So I want to make sure that we don't underestimate. I think the entire community intervene, government, partnerships, everything came since 2020 to make sure that we supported our community, that at that time, 2020 highlighted a lot of health disparities, and I think it's part of why they were affected in a very high levels. Next slide, please. So Mary Center had the opportunity to partner as also a very trustable community member. We were one of the first ones to do testing on COVID in April 2020. We also started vaccinating as soon as they were approved as emergency basis with all the vaccines at every different ages that were approved. We have by June 2022, we have applied 50,000 doses of the vaccine, over 27,000 of people, and more than 5,000 children under 12 years old. We have tested today more than 50,000 community members. Next slide, please. And I want to make sure we highlight again. I think I alluded to this. Since I had the opportunity to work, as Rafael mentioned, in the District of Columbia since my first day of professional life. So I consider myself a Washingtonian. I don't know any other city of professional life. So I have been in the city since the 90s, and I am very proud to be in the District of Columbia because I started working at Mary Center as a volunteer Saturday to attend adolescents, and it's a tremendous miracle and help that we have provided to our community. It takes a village, and I want to make sure that if this is at least short, I totally believe so. But I want to make sure I highlight all the communities that DC Matters is a collaboration of a lot of HSQC, like Community of Hope, Children's National, Unity, Howard University, and you have the list here. DOH is also assessing how can we continue educating our community members about vaccination for COVID, about vaccination for other diseases. The major Hispanic office is also very involved. I'm sure that, I don't have a space to tell you how much we're all working on this, and it takes a village to really make the good changes and the best changes for us. Thank you. Finally, we are in a very important moment historically, and I want to make sure everybody knows we are extremely appreciative that we are all here together to do this and work together to improve our community members at all times.
Thank you so much, Dr. Marquez. It's a great overview that you just gave us, and all those topics that you touch. Probably we need to do a lot of webinars to expand on those because they are very important for our community. We have talked with you in El Tiempo Latino, and you always have like a lot of very, very good information, and we are learning a lot with this webinar where we have experts talking about the new challenges for Hispanic health. Our next guest is Dr. Maria Lauer, who will talk about the Hispanic community mental health care. A little bit about Dr. Lauer. She's a bilingual, bicultural clinical psychologist at Children's National Hospital who specializes in child and adolescent mental health with expertise on working with Latinx and immigrant families. She provides mental health services in English and Spanish through mental health integration in primary care and speaks on issues related to the needs of immigrant and multi-status families. Dr. Lauer, it's a pleasure to have you here.
Thank you. Thank you for having me. I really am honored to share this space and time with my panelists and everyone that's tuned in. Next slide, please. As we have been seeing, mental health is a priority of concern for the community right now. For us that are in health systems, we are seeing an increase in concerns related to behavior, concerns related to mood, and concerns related to academic progress and development. This slide, if if you can click through the next few, is just a sampling of how the news are reporting what is happening for our young people. And I will say my presentation is focused on young people. It's my expertise, but we live in systems, and so really it's about the health of the family system. But our children are in a period of increased mental health need. There is the crisis didn't start in the pandemic. This crisis has been building up, and it has sort of two prongs. One is the fact that we are becoming more knowledgeable and more accepting of mental health as a part of our health, right? That our brains and our minds are a part of our body, and that they all work in junction. And so if we're going to be taking care of our health, we have to also be mindful and pay attention to our mental health care. So as more of us become comfortable discussing our mental health, as more of us seek care for our mental health, we're finding that the systems that exist are not equipped to meet that demand. And that's resulting in this crisis where there are more young people who need care than there are available providers. This is going to force us as a field to be innovative and to find solutions and to grow. But we are in that growing pain right now. The Biden-Harris administration has put forth programming to try to support the expansion of providers, mental health care providers across different levels. And they have a strong focus on making sure that there are mental health therapists and providers within schools, and that they are accessible to the children that are in those schools. So the mental health crisis was bubbling. The pandemic really has worsened. I don't think I'm going out on a limb and saying that all of us are a little worse for wear after the pandemic, and our young people are no different. The isolation that we experienced, the lost time with peers, the lost time in academics, the increased stress that is perceived in the household are all variables that are coming from the pandemic and the period of time where we had restrictions, but we are seeing a lot of the effects and the outcomes now. The other thing I really want to mention, and this may be, I understand that we have caregivers and parents here today, this may be something that's on your mind, but social media has become a much larger portion of how our young people spend their time. And we're starting to see really solid data that tells us that social media can be quite harmful for the developing brains of young people. And so I just read in the news this week, I believe Washington State is actually attempting to sue social media companies for their role in potentially worsening youth mental health. So keep on the lookout for that. Next slide, please. The other area where we're seeing some worsening, and we think it's in part related to the pandemic, is academic attendance. More children are chronically absent from their classrooms after the pandemic than ever before. And the data that I'm presenting here is for DC specifically. I want to send a big shout out to the chronic absenteeism team here at Children's National. It's a larger partnership, but one of the cool things that that program is able to do is obtain attendance information. And so we're able to see that more children are missing school days. Missing school tends to be a symptom of other problems rather than the primary problem. Things that could cause mental absences at school could be mental health concerns, but it could also be social determinants of health, right? Challenges with insufficient resources, such as having a living wage, having affordable and accessible healthcare, affordable and accessible and safe housing, and other barriers that may unleash a sense of instability in a family and a household and result in a young person missing school. Being chronically absent it's not too hard. If you miss 10% of school days or about 2 days a month, you will enter into the chronically absent category. And there are long-term negative outcomes related to missing school, including economic, career attainment, and others. I want to be linking all of these things together because as we think about the ecosystem or the spaces in which our young people spend time, school is a primary source of services. It's a primary source of contention for young people. So if they're not there, not only are they missing instruction, but they may also be missing their therapy appointments, and they may also be missing the extra services they may get for their individualized needs. Next slide, please. So what I wanted to take a little bit of time and do today is really orient us towards what I think of as yellow and red flags for mental health care. It's a really good time to be paying a little bit more attention to the young people in your life and to sort of tune in to what they are experiencing right now. When you're thinking of yellow flags, I want you to be thinking about and paying attention to changes. We all change over time. Certainly children are developing across their lifespan and changes are to be expected. But any changes that result in the person feeling like they're not themselves, or you perceiving them as there's been a change to their personality or the way they're relating to me or their mood, we really want to just be monitoring and talking to our young people about this. So I'm listing here some common things, but increasing in irritation, someone who is spending a lot of time mad and they used to be a happy, sunny, go lucky kind of person, more sadness, for littles, more behavior difficulties, more tantrums, more defiance, changes in sleep and eating, changes in motivation. Maybe someone was really, really enjoying school and all of a sudden they're not completing their homework or they're asking to stay home more frequently. All those things should be kind of raising that flag in your own brain of, I wonder what is causing this. I wonder what's going on that's moving my child into this more negative direction. Some of the things you see here can be symptoms of an existing mental health condition. Often hyperactivity can be a sign that someone should be assessed for something like ADHD or excessive fears and worries, right? I think in Spanish, we always use the word ansiedad, estoy ansiosa. And we may mean lots of different things, but when I say anxiety, I really want you to be thinking about fear and worry. And the fear and the worry is so impairing, it's so big that it's preventing me from doing things that I want to do. That might be a child who in the morning is complaining about tummy aches or says they feel scared and they don't want to go to school or they don't want to leave you behind and be separated from you. So it's always important to be curious and ask. We all have bad days, right? So having a young person who is just having a bad day and they're irritable and they're grumpy and they don't want to eat that day and they're kind of locking themselves up in their room, one day those concern me, but be looking for those trends because those trends do concern me. And so be connected and be curious and ask your child about their perspective on the changes. What do they think may be causing some of these differences for them? Next slide, please. There we go. Thank you. So let's talk about some actionable steps that we can take. One of the biggest things that I'm often talking to families about is the use of routines as a way of stabilizing and communicating that things are fine and that mom and dad and whoever the caregivers are the adults. They are going to maintain the safety of the household. They are going to make sure that everyone's taken care of. And for children, the ability to trust that there's a routine, to know that there's a certain time where I sit down and do my homework. There's a certain time when it's my bedtime and I have to do my bedtime routine, creates a healthy buffer. It can be protective of some of the stressors that they may be experiencing out, in the household or outside of the household. This also helps them pace their day. I think something that we as adults sometimes forget is that our young people are not going to be making decisions in the same way as an adult is. I am thinking, how much time do I have to get to work? How early do I have to leave in order to manage traffic? How much time do I have to relax in the afternoon? Did I get all my work done? Young people are often going to be directed by what feels good in that moment, what they're most interested in, what they want to do. And so the adults creating pacing for them allows them to know both that there's someone that can help them navigate their day, but that there's also someone who's going to tell them when they have to shift priorities, right? That they can't, say, play video games for 4 or 5 hours after school each day. There are some tasks that need to be done. Another big piece, and if you're not doing this now, I would encourage you to start, is establishing a good open communication with your child. What we try to do as adults often is ask questions. What did you do in school today? What did you learn? What happened? That is not always the best strategy because our children receive questions constantly. And there's a level of burnout that comes from not exactly knowing what I'm being asked to report on. What happened at school today? Nothing. What did you learn? Nothing. Did you have a good day? Yeah. Right? We're asking questions that are not prompting for the communication that we're looking for. And so a few tips to improve that would be establish a routine time for parent and child connection. It doesn't have to be a long amount of time. Depending on the age of your child, it can be as little as 5 minutes, as long as 15, 20 minutes with your adolescents. And during that time, your job as a caregiver and adult is to get interested in whatever they're interested in. Right? This isn't a time to ask questions. This isn't a time to give advice or to give lectures. This is a time to get to know your child. And the more that we are consistent with that, and the more that we open a low intensity space for our children, the more that space will be used for communication about what is going on in their lives. Another piece will be make sure that you can model coping skills. We have coping skills. We're adults. We made it to adulthood, so we've managed. What we don't often do is go the extra step to help our young people learn. And so for me, for example, I might be driving and there's a lot of traffic and I'm feeling really frustrated. And so I turn on my favorite podcast because I know that will distract me and it'll just allow me to keep on driving. That's a coping skill. One way that you can externalize that from you and show it to your child is just by narrating. What I just said to you, I'm feeling really frustrated with this traffic. Oh my goodness, I can't stand sitting here. I'm going to do something to make myself feel better and to entertain my brain. I'm going to turn on my podcast. I did the same behavior, but now I externalized my thinking and role modeled for my child what coping can look like in that situation. Another piece that's important is your own mental health. Checking in with yourself, understanding where you are with your own mental health, and connecting with care if you need it is another way that both you're role modeling health care and you are role modeling that mental health is just a regular part of taking care of ourselves. Your children are going to follow your modeling. I know Dr. Keon is going to speak about immigration, so I'm only going to touch on acculturation really briefly. Acculturation is the process of absorbing the values of a larger culture. And so this can create conflict between parents and children around values. For example, the highly individualistic American culture versus our more family-oriented or communal cultures in Latin America. If you're finding yourself constantly battling about negotiation of independence, you might be running into some acculturation stress. And there's some things that can be done around that to help. And lastly, I want to be certain to mention, be careful not to minimize. Sometimes our own struggles feel really great. And when we see a young person who, they have safety in their home and they're going to school and they have new sneakers, it feels like, how could you be depressed? What is there for you to be upset about? Whether or not you believe that, communicating that is very invalidating. And it teaches our children to not trust what they're feeling, to not trust their internal experience, and to hide things from us because we're not taking them seriously. So all you need to do is validate and say, it would be really difficult to feel that way, or I can see that you are having a really hard time with this. Thank you for sharing with me. I plugged in some resources that are local to us that I hope folks are familiar with. The one thing I'm going to say, I'm embedded in pediatrics. Always talk to your pediatrician or your PCP or your child's PCP. They can hold on to your healthcare journey and help connect you with needed care.
Thank you so much, Dr. Lauer. It was a great overview about mental health. So now we have Dr. Natalie Bernabé-Kion, who is going to talk about immigration and mental health care. She has been a practicing pediatrician for the past 25 years. The focus of her practice has been on medically underserved communities, particularly in Springfield, Massachusetts, Arlington, Virginia, and for the past 15 years in Washington, D.C. During her time in DC, she has been active in medical, student, and pediatric residency education as a member of the faculty of Children's National Health Systems. She currently serves as medical director of the Children's Health Center at Adams Morgan and Shaw. Dr. Kion, it's a pleasure to have you here.
Thank you very much. I hope you can hear me. So thank you very much for having me. And every time I come to this kinds of events, I can't help but say that I keep on learning. And thank you very much, Dr. Marquez and Dr. Lauer. I heard a lot of things that hopefully I would be able to add to the information that that the group is receiving. So let me, next slide. Yes. So let me start. I want to start actually with sharing my own personal story as an immigrant. Providing care to the immigrant community has actually made me acknowledge the many stressors migration had put on myself and my family. I was a twin, I was only 11 when my parents migrated to the United States, and I was the oldest and had a younger sister and brother. And although we were left with a caregiver, I had to grow up really quickly and take charge of my younger siblings. And it had taken a long time, decades, for my family to resolve all the trauma and stress the separation had caused us. So it's a familiar story, and it's a familiar story I hear from my patients. So, but my experience and looking at this graph or infographic, but my experience seems nothing compared to what my patients and the community I serve have gone through. Many of them have started even from the beginning, the primary stressors as discussed by Dr. Marquez, violence, severe poverty, war, that have pushed them to leave. And then the migration itself, the journey itself, the trauma itself of the migration, which is sometimes months long and through very dangerous terrain and situations. And even as they arrive to their destinations, they're still met by a lot of problems, including discrimination, persistent poverty, isolation. Definitely also, as mentioned by Dr. Marquez, COVID itself had put another stressor to what was already going on. This might not be an experience of everyone, but definitely there are definitely a lot of members of our community and the community that we serve that have gone through this. And I just want to be very mindful of that as we take care of our community. But as a pediatrician, I want you to concentrate to the lower part of this graph, of this slide, and that's the moderators. How can we make it better, and how can we build resilience? And this is more on a community level or as a systems level. How do we create supportive families? How do we make sure that the kids, the youth, or even the adults have educational opportunities? How do we make sure they have peer networks, employment, access to services, community integration, and collective identity? These are all things that can make all the stressors somehow at least better. This should be all within our reach to make a difference. Next slide, please. So, and this is this is not DC, but it is in New York. It's a study that came out in July 2022. It's a study on the social determinants of health of the immigrants in New York, particularly in Brooklyn and Queens, by the Center of Migration Studies. And most of the respondents to the study were Hispanic or identify as Hispanic or Latino. And when you look at this,
determines
basically mean those are the non-medical, non-health causes of different causes that actually affect our health. And you could see here how different it is for the U.S. born people in New York City versus the foreign born. Their challenges are usually no health insurance, but I think it's better for us here in DC. There's no personal provider that they find. Food insecurity is such a big problem. And going back to what to our talk about mental health is there's definitely a big difference between those receiving mental health and particularly in our foreign-born communities, and also, and it's not surprising that we will see that a lot of our community basically is reporting that their health is poor. Next slide, please. So this is also from the same study, looking at barriers to immigrant receiving health care for mental health. The left is reported by the immigrants, and the right is reported by the providers. I think if you look at each one of those barriers, I think we won't be surprised. From the point of view of the respondents, one is that they cannot take time because of work, because they have to care for children or for other reasons. Another is lack of health insurance, or the insurance doesn't really cover for mental health. They cannot afford the services if it's not covered. And the wait time for appointment, I think particularly looking for a bilingual, bicultural mental health provider is such we call them unicorns because it's really hard to find them. Number 5 is lack of knowledge about treatment options. And then also wanted to see if the problem, this is a common thing I hear also from our patients, is wanted to see if the problem would get better on its own. But by the time we actually see them, the problem is already blown out of proportion. Another common reason why they don't, our patients don't receive mental health is that is too far to travel, fear of treatment, and no means of transportation or language barriers. So, but looking at this reasons, these barriers, you can see that there's so many opportunities for us to make a difference, to actually be able to address the mental health concerns of our communities. Next slide, please. So I don't want to end on a really sad note. I think as a group, the DC American Academy of Pediatric chapter, we have a committee on immigrant health, have come up with what we call the DC AAP Immigrant Health Toolkit. And you can just Google it. This should be one of the first things that come up. It's a toolkit of resources, including health, legal, educational, social services, and mental health. And actually, we are currently updating it. We developed this in 2016, and of course, so much has happened in the past few years. We hope to have an updated toolkit up within the next few months. But even right now, you can see that there is a lot of information that you can use in your practice, or in your community, or in your families, so that to make a difference. It's far from being a magic bullet, but I think for many of us who work in our community, it has made a big difference. And next slide. Another approach that we have come up with at Children's National is we do have an immigrant health program, which we hope is helping fill the gaps in terms of healthcare. One is we provide case management for children with special care needs, particularly those who are uninsurable, we are lucky here, as mentioned by Dr. Marquez, that most of our kids who are based here in DC get health insurance, and particularly those who have special health care needs. But this is not actually the situation in our neighboring states, which is in Maryland and Virginia, and many of them also come here for care, come to DC for care, and come to Children's National to try to fill in that gap by trying to figure out how to provide that care. Another thing that we have done as part of our immigrant health program is also definitely education. And I want to just say that this is coming up in the next few months, starting in January all the way to April. It's on education not only for our healthcare providers, but also for our community, as we continue to face a lot of challenges. And then right now, we are currently managing a program to provide care to our newly arrived members of the community from Venezuela. And we have a mobile van that goes to a number of the shelters providing vaccines, and hopefully with the cooperation, actually, and collaboration with a lot of services within the District of Columbia, we would be able to also give them primary care. Again, it's still a Band-Aid to the current and many challenges, but we hope that this is helping the community as we find better solutions. Thank you very much, and it's a pleasure to be here.
Thank you so much, Dr. Kion, and thank you for sharing those resources. Most of the resources are being shared also through the webinar chat. You can check the webinar chat for links and other updates while we are doing this town hall. We have our last guest for the town hall before going to the questions, and is Antonio Guernica. He will talk about the importance of health insurance with DC Health Link. He's a director of business development at the DC Health Benefit Exchange Authority, and he's responsible for working closely with the diverse communities in the District of Columbia: African American, Latinx, Asian and Pacific Islanders, LGBTQ+, and women-owned small businesses. He has a strong track record of successful leading media startups and new businesses and marketing initiatives. Today, Mr. Guernica leads the DCHBX efforts to expand and retain small business coverage through DC Health Link. Thank you so much, Dr. Guernica, for being here with Mr. Guernica for being here with us.
Gracias, Rafael. And thank you. You know, my mother always wanted me to get my doctorate, but I never did. So she'll be happy that you said that. You know, we've just heard some powerful information and provided with a great overview of the state of Hispanic health in the District of Columbia, which speaks clearly, you know, to the importance of health insurance for the Latino community, for our community, and how DC Health Link can help them to obtain coverage. So let's get started. You know, why should I get health insurance? Or why should the Latino community, or members of the Latino community, get health insurance? You know, it's obvious. You know, it helps to keep your family healthy. If you have health insurance, and there's a health issue in your family or for you personally, you're much more likely to go and seek medical service, seek treatment, than you would if you don't have health insurance. If you don't have health insurance, it could well be because you feel that you can't afford it, and so you're even less likely to look for medical treatment. So number one, helps to keep your family healthy. And these are things in all kinds of ways. Secondly, and perhaps most important, it protects you and your family from financial disaster. You know, one of the biggest reasons why people in this country declare bankruptcy is because of they can't afford to pay for medical services that they received. It's not something they were expected. It could be from a chronic illness. It could be from suffering a serious accident. But as you likely know, I mean, the cost of medical services is very, very high in this country. So it will keep you from suffering financial disaster. And thirdly, gives you peace of mind. there's a lot of things that you can do. There's few that give you the peace of mind that obviously, God willing, you don't suffer a serious illness or a serious accident, but that's not the way that it works for everyone. So this gives you peace of mind. So this being the case, that it's a compelling argument to get insurance, why don't the uninsured get coverage? Mostly because it's not affordable. And again, for Latinos in DC and throughout the country, have a lower median household income than does the general population. So there's less money to go around to buy health insurance. And Latinos are among the group. Well, they're most likely not to have health insurance. That was covered in some of the previous presentations. And part of it is because we're an immigrant community by and large. We've been here, some of us have been here for generations. Some of us, arrived yesterday. But it is an immigrant mentality that we bring here. And I don't know about, I don't know how many immigrants who come to this country arrive speaking English. I didn't. I had to learn as I went along, as is the case, I think, for the large majority of Latinos and Latinas who immigrate to this country. And being an immigrant just gives you a different mentality, so I think that and health insurance is not as popular, is not as prevalent in Latin America as it is in the US. So it's all this part of just learning what you need to do to keep yourself safe and to keep your family safe in the US. And also, DC HealthLink can help you get quality, affordable health insurance with premiums as low as $14 a month. Now, I don't know how many Latinos go to Starbucks, but you do a couple of lattes and boom, you have your premium for the month right there. So, the state of health insurance changed dramatically for the better. With the advent, excuse me, of the Affordable Care Act, and with the Affordable Care Act, it protects us against unfair insurance industry practices, such as, for instance, denying coverage because of pre-existing conditions, discriminating based on gender, sexual orientation, or gender identity, or charging higher premiums for women who are of childbearing age. Can't do that anymore. And the importance of your benefits under the Affordable Care Act is that the ACA, or Obamacare, it's also commonly known, said that any insurance plans from that day forward had to cover a comprehensive package of essential health benefits. And you can see many of the things that they covered: doctor visits, hospital stays, maternity and newborn care, lab tests, and more. they're all there. I mean, it really is a robust package of health services that everyone needs, and even if you don't need something like chronic disease management or mental health care, you're happy that it's there and that you can call on it. It's real insurance. So how do you get coverage? Well, we do it through DC HealthLink. DC HealthLink is the online marketplace, and it's a one-stop shop. We really don't turn anyone away. Okay, your immigration status does not matter to us. Your income does not matter to us. We will do everything that we can in our power to help you pay for health insurance or apply for Medicaid or Alliance or whatever any other program that's available. And we've been doing this for 10 years now. DC has the second lowest rate of uninsured residents in the country at 97%, but we're not satisfied. We want to get to 100%. I started at DC HealthLink less than a year ago, and I have been super impressed by the dedication and commitment of my colleagues. I mean, I'm telling you, everyone there wants to get to 100% coverage. We want every person in the District of Columbia to have affordable and quality health insurance, and they will leave no stone unturned in getting you there. So how are you eligible? It's really simple. You just have to live in the district and be uninsured, and then you're eligible to get health insurance. That really, it's nothing else matters. You live in the district, you don't have health insurance, come to dchealthlink.com and we will help you get affordable health insurance. And as I said, we'll leave really no stone unturned. Financial assistance is available. We'll look at any program that can help reduce premiums, whether it's a federal program, a local program, anything. And as I said before, we have affordable and quality health insurance plans for with monthly premiums as low as $14. So it really is incredible. DC HealthLink also focuses on standard plans that provide a menu of medical services without the patient having to cover deductible. And in previous presentations, it was highlighted that the Hispanic community suffers from diabetes to a much greater extent than does the general population. New in 2023, the plans will cover treatment for diabetes type 2 without the patient having to pay a deductible. And this is just plan offerings. We know it's not just one or two. We have 27 individual and family plans that are available for this year. This is really important. Open enrollment period ends at the end of this month for individuals and families. It's and really open enrollment is when practically everyone or the large majority of people sign up for health insurance. Now you can get health insurance after January 31st, but it gets a little bit more complicated. You have to have some sort of a special event, such as you get married, you get divorced, you have a child, you move to the District of Columbia. These would all be events that would allow you to apply and enroll in health insurance. But really, look, what I say, don't procrastinate. Just go ahead and do it. You will feel better after you do it. And then free help is available. I mean, the best thing to do, and really, I ask you to share this with this information with anyone that you know that is uninsured and that is uninsured. Period. Go to dchealthlink.com. We have just reams and reams of information on the website. It's available in English and in Spanish. We will walk you step by step through the enrollment process. We'll look for every financial support that you're eligible for. We'll just really, we are committed to making sure that you have affordable health insurance and that everyone in the district has affordable health insurance. And that's it. Thank you. Again, I ask you, please share this information with folks who need insurance. You'll be doing them a big favor.
Thank you so much, Mr. Garnica. And the information also, you can find it on the webinar chat. There are links for DC HealthLink that will help you to get insured during the open enrollment period. Thank you so much to the 4 panelists for all your insightful information. So now we have arrived to this questions part of this town hall, and we have a question here that I think is really important, and that I would like to have all of you participating in answering this question. One attendee says, could you speak to community outreach strategies that are best practices for health promotion, positive behavioral health outcomes? And the same person asks, do we need to change the way we think about community health outreach since the pandemic? So I think that's a very important question, and I would like to hear from you. What would you say?
You asking me?
To start? Yeah, Antonio.
That's all right. Look, we do outreach every day to encourage Latinos and Latinas to enroll in health insurance. One thing make sure that it's you have the material available in Spanish. You know, that's really pretty obvious, right? The other thing is to engage with them. You know, it's you know, few people like being lectured at, you know, or told, hey, you need to get health insurance because it's good for you. Yes, it is good for you, and you do need to get it. But no one likes to be told what to do, you know. So try to engage with them, find out what their concerns are, what personally affects them, and then if you can respond to those concerns, you know, you're on your way.
Thank
So
you.
great.
Dr. Marcus, please.
Yes, great points. I totally agree, and I mentioned a little bit about the new normal. I think everything is being reassessed, and to make sure that it's effective for our communities and our needs. And that's something that we always have to keep in mind. It should be person-centered. We all are going through different challenges, and we're here speaking about Hispanics, so is a group, ethnic group that we are discussing in this virtual town hall, but it's for everybody. Is you know, Mary Center, it has been a community center that has been partnering with the community, is all with the community. What they need is client center, patient center, participant center. We call them participants. It's like, and that's why it's going to change. Is we just have to be aware and assessing every day, because every day we have something new. Is you know, there's a lot of challenges that we talked today. Some things we're doing better than what other ethnic groups are doing, but some others are climbing, like mental health. We call it a Mary Center behavioral health, and really there are some solutions coming out, and it has to be within the community. It cannot be within a building, hospital, clinic. It has to be within the community.
Dr. Kion, please.
Yes, the only thing I would definitely mention, besides the things that I already mentioned, is one is, and it's really, despite of the fact that social media can definitely have a negative impact, we still are going to be able to still use social media. And in social media, we have our communities need to see themselves, right? The representation has to be there, and that's one. And the second thing is, I think in many different arenas, we've already been using a lot of stories in terms of telling how this definitely affects, like how getting health insurance, or getting behavioral health, how in a very personal level, and getting that out there is I think very important, and it really gets people's attention when we use that. So that's the two just the things that I would add to our conversation.
Rafael, I'd like to add a little bit to this. I think also what's important is that we really lean heavy on trusted voices in the community.
Yes.
Trusted voices become very, very important, because people listen to people who look like them, that sounds like them, and who they know care about them. There is a poet who once said, if the beautiful see themselves, they will know themselves. So we present the beautiful people before them that they're most familiar with, then they begin to listen. And so we have to go the extra mile to reach our communities where they are. DC HealthLink's motto is meet them where they live, where they work, where they shop, where they play, and where they pray. And this Sunday we were at Our Lady's Queen of America Church, and we had sisters there, bilingual sisters there, talking with people on a very, very human and personal level about their health concerns, and how getting health insurance is a major step toward helping them to become whole and heal within the community. And I think those kinds of approaches work. It has to be cultural sensitive outreach vehicles to which we reach people. And we have to use every vehicle available to us, communicate to people in more than one way. Some people like television, some people like radio. Other people like social media. Some people like TikTok. They are different. You have to be open to all forms of communication to reach people to ensure that they get the messages we want them to receive.
Thank you so much, Dr. Lauer. Something you would like to add?
I just want to mention that we really need to keep a bottom-up perspective. Community members should be seated at all the tables where decisions are being made, and not just community members like us. We hold a lot of privilege in this panel, but community members who have all sorts of life experience that can advise us on how to best do. I think historically we've always done unto, and are surprised when people are now buying what we have to sell. So. Another thought.
Thank you so much. We have two more questions that just arrived. One is there a DC Latino health needs assessment? May the person say maybe like the former State of Latinos in DC, or a report resource that you can refer us to that could assist in strategizing, improve our outreach efforts?
So DC Health Matter is a collaboration of multiple federal health centers and Children's Hospital Howard and different organizations in the city. And they are addressing Hispanics and any group, ethnic group, large ethnic group in the city. And with specific health components for each main challenges, especially recently. We're not like having data for 2023, but we are already at 21, 22. So it's the first thing if you want to learn more, and they do have very specific recommendations. We do know, as we say, and I agree with Maria, one of the things that Mary Center did since the beginning, more than half of the board of directors are participants. And it's necessary because, again, we have different perspective, even though some of us may be part of the community, but each of us have different identities. So it's something important to add diversity of intellect as well. So I think that's one of the organizations that is really working hard, but it's also in collaboration with different kind of perspectives about health. And that's what I like, because it's not just federal health centers. It has academia, it has community centers. It's a large organization, and they're very effective in capturing what's going on, and they're also providing support to make the changes necessary. As we mentioned, this is very new to us, and it's a new normal. And I think, in my opinion, is human that we have to aim to the best.
Thank you so much. We have one more question that just arrived, and it's about mental health. It says, what would a mental health service provider have to do to join the Biden-Harris program and offer services to the Latino community with the purpose of supporting the insufficiency of service providers?
So I would first encourage folks to take a look at the mandate and what's included in it. A lot of the funds are being routed through districts, academic districts themselves. So they will be posting positions for school counselors or mental health therapists, and it will speak about the level of license and other things that are required. I am not aware of a way to get connected outside of those processes, but there may be. If I come across any additional information, I'm happy to share if we have a way to share, if other panelists know.
Thank you so much. Someone who would like to add anything to that question?
I think if they get in touch with the White House Office on Public Engagement, they have a weekly session that they hold every Thursdays. And it's during that session and the people that's on that line that you can contact if you want additional information about what the Biden administration is doing and how you can access the services that they have. The White House Office on Public Engagement.
Fantastic, thank you. One question that we have, like something that, you know, is based on our experiences at Tiempo Latino. I have had the pleasure to talk with many of you on Facebook Lives with El Tiempo Latino, or interview you for the paper. And of course, you are experts in communicating to our community the sometimes difficult part of healthcare, like COVID, when we had like the peak of the pandemic of diabetes, or mental health, in a very easy to understand way. In a way, you are interpreters of the difficult information in an easy to understand way for a community, and that's very important. And that's why it is very easy to have you and talk as experts in an easy to understand language for the community. What would be your advice to other colleagues and people getting into the health industry locally from any point, mental health, insurance, primary care medicine in general? What would you tell them, that even if they are not working directly with or specifically with one community, what would you tell them, or what would be your suggestion for them to get more in touch with the different communities, the diverse communities of DC?
So, Rafael, I'm going to start, not being the last one, please. One of the things is really, we need to make sure that we tell community members, and I'm included, that you see them. So what does really mean? We all matter. We all matter. No one more than others. So, and I fight for this every day with my own identities, but I want to make sure that we all, when we decided to work with other people and help other people, like we do in healthcare at least, is we have to make sure the other person, regardless of who they are, know that we are seeing them. And we decided to do this. We're going to be here for you. And we want to make sure we learn from them all the needs, and then how can we support for the well-being, because we all want to be better. It's human, right? And that's why we walk. I mean, I want to tell you, like, I am Venezuelan. I grew up never dreaming that any Venezuelan was going to leave my country. It's a paradise country. And right now it's going through a very hard moment. I mean, we don't have food, we don't have medicine. It's tough. And, you know, seeing my people walking through the Darien's wood is something that I never dreamed in my life. And I never learned about it, never thought any human will do this. And it's a lot of it's a lot of things that we have to make sure that we learn about the person, regardless of who you are, and then support their needs.
Excellent. Learning about the person, supporting their needs. Thank you so much, Dr. Marquez. Someone who would like to add to that?
Yeah, I can say something, and I come from a media background, and you know, oftentimes, I mean, 20, 30 years ago, you could send out, broadcast a global message or a very broad message, and it would be received and you would get some results. That's just not the case anymore. You know, I mean, first of all, with social media, you can go and talk directly and specifically to the people that you want to reach. The message that you craft for the Hispanic community that's going to be effective is not going to be effective with, you know, perhaps with the African American community, with the LGBTQ community, with the general population. So, you know, you kind of, you need to do a process where you establish, okay, what are your priorities? What are the groups that you most want to reach? And then develop strategies to provide a relevant message and a way to reach that community. And then I think you'll be successful. But, you know, you can't reach everyone with just a bland, everything message.
Thank you so much. We are approaching to the end of this town hall. We have about 7 minutes and we have one more question. And I want to be mindful with the time of all the participants and attendees. So I know Veronica will let us know when we are approaching the deadline. So we have the following question. What are some of the challenges Latinx, Hispanic senior citizens face, and what are some of the areas of improvement for healthcare providers and insurers? Who would like to take that question, or the first person to take that question about senior citizens?
Well, I can start. I mean, is access, right? Again, what Mr. Antonio Guernica mentioned is really each of us have different needs, even if we are Hispanics, all of us. And that's why knowing their needs is important. But they have created centers that are specific for more towards the need of Hispanics above 65. There are different even vaccinations, different medicines, a lot of different things. And again, I as we mentioned, and this is maybe bringing Maria Lauer, is like is the brain, in my opinion, I call it brain health, behavioral health, mental health, suffered a lot during the last 2 years. And isolation, we learn and we live socializing with others. It's part of our doing. We also, kids learn mirroring, copying others' behaviors. So keeping them alone with the same people in the same house because protecting for the virus is one of the worst things we had lived for development of the brain and health of the brain. So this is coming, and this is also for elderlies, but we're all trying to target this in different organizations. I can talk about Mary Center. We have 2 senior centers, but we also are creating a long COVID clinic. We also creating a geriatric clinic. So is making sure that we all do this, and the coverage, as we talk about, and Mr. Garnica may add, is exceptional in the District of Columbia, and that's why I applaud this a while ago. We need to do better. I agree with you, Dr. Garnica. Mr. Garnica, is 100% the aim.
Thank you so much, Dr. Lauer. Dr. Kion, you would like to add something to this? I think we can. You are muted, Dr. Kion. Okay. There's some technical difficulties. Dr. Lauer, would you like to add something while Dr. Kion is fixing her microphone?
I just want to emphasize that what Dr. Marquez said is exactly right. Research has come out in 2022 that isolation is similar to chronic smoking of cigarettes in terms of the damage to the health. And so do not underestimate our older community members who may be experiencing isolation. Addressing that would go a long way, I think, in terms of creating buffers and protective factors.
Thank you so much. Dr. Kion, I don't know if your audio was fixed. Okay, now we can hear you. Yes.
You can hear me? Okay,
Yes.
good. Oh, this is a response actually to the other question you have, and including this. And one thing that we unfortunately did not mention, I mean, the other pandemic that actually happened together with the COVID pandemic was the pandemic of misinformation. And I just want to mention that and make sure that in response to your question, unfortunately, certain populations are being targeted by different organizations for one agenda or another. And it's great to be able to really involve people who are really who are working in those spaces, particularly regarding to health. And I want to make sure that you to know that we are available. We are in a person to person and in community level, we really want to be able to send the right message out, and we will be here to support our media people to be able to get the correct message out.
Thank you so much, Dr. Kion. And of course, we are committed to also provide the right information. We're so happy to be in this town hall that is 2 minutes away from ending. So I would like to remember all the participants that you will receive the slides, the PowerPoint presentations of all the doctors and Mr. Garnica. And you also will receive a survey about so you can evaluate this town hall and we can improve it for the next time. So we would like to hear from you. Always stay connected. There is information on how to connect to each of the participants and their organizations in the webinar chat. And also you can connect through the organizers using the link you got for registration. So you have all the information there. Thank you so much to all the participants. Really great talking with you. And thank you for joining this web forum. I know Veronica will have a final remark probably before we say goodbye.
Thank you so much, Rafael, for being this amazing moderator today. Thank you, Dr. Natalie Kwan, Maria Lauer, Antonio Garnica, and Dr. Maria Marquez for being here. This was an incredible webinar that we have. And we also want to, I want to thank you, Linda Wharton-Boyd, for being here with us today. So for everyone to be here, thank you so much. Don't forget to enroll through dcheadlink.com. You have until the end of this month. No se olvide de inscribirse a dcheadlink.com. Tiene hasta el mes de junio 31 para que se inscriba a los seguros de salud. Muchas gracias a todos. Thank you very much. Have a great weekend. Bye.